Power of One. Today, we're going to have a very important conversation with Dr. Vora, who is a cardiologist. It is very important that you pay attention to your body, and it is very important that you schedule your yearly visits with all of your doctors. It could save your life. Welcome to the show, Dr. Vora. Dr. Vora, tell me about proper heart health.
So heart health really stems for the full person health. And so if you take care of the heart, that means mainly eating well and exercising. If you're doing those things with lifestyle, that is going to lead to proper heart health.
How can one determine if they have health issues? And I'll give you an example. We'll talk about my dad. He just turned 80. My dad, all of his life, well, I want to say all of his adult life, ate very healthy, exercised, great shape.
Mm-hmm.
June 20th of 2022 changed our lives. So my mom was saying to me, I want to say a couple of weeks before June 20th, she said, Melany, I'm so worried about Dad. His legs and his feet are swollen. And my dad wears like genuine cowboy boots. I'm like, Mom, Dad is going to be 80. Tell him to take those darn boots off and put on some flip-flops. He's also a pastor. Yeah. Well, he woke my mom up June 20th, like 3:30, 4 o'clock in the morning, and said, sweetheart, we have to go to the hospital. I'm much like my dad. If I have a high tolerance for pain or whatever's going on with my body. Long story short, when he went into the hospital and I saw him that day, I'm like, what's going on? It was the wheezing. It was the shortness of breath. And he just looked tired. And my dad was diagnosed with heart failure. We were so surprised. My dad has arthritis from head to toe. And my mom said, I knew my husband would be shriveled up. That would probably cause his death one day.
Yeah.
But never in a million years will we think of heart failure.
Mm-hmm. Absolutely.
In old age?
So unfortunately, this presentation of heart failure is common. And especially for men like your father, who have been likely strong and healthy their whole life, people tend to ignore their symptoms until it becomes critical. And so while it is more common than you would think, I think going back to the original question of how do you know if you have a heart problem? I think the first step is to always listen to your body, try not to tough it out, and see a doctor, because the earlier we find things, the better it is. And the easier we'd be able to manage things before they progress.
Right. And he's faithful. Like he would go to his primary physician and they were looking at him in the hospital and they was like, well, when was the last time you saw your primary physician? And he was like, about a week ago. So they were really surprised. I don't know if he said, look at my feet, or look at my legs. Mm-hmm. It changed our lives from June 20th to today. So my dad he has something called TTR. Mm-hmm. And the proper name. I always chop up this name. What is it called?
Cardiac amyloidosis.
There you go. Yeah, I can not get that. And it has like totally changed our lives. But now, is that common in young people?
So cardiac amyloidosis is more common in elderly people. Okay. It was previously felt to be a rare disease, but more and more we're actually finding it because we have better diagnostic tools and we have imaging tools. And so previously, it was always thought of as a disease only of old people. Old people, I put in quotes, of the elderly, but it actually can affect younger patients as well. But typically, patients don't get diagnosed until their 50s.
Okay, doc, that didn't help me because I'll be 51 this year. But I'll be calling you offline. I'm just saying, a little bit of a hypochondriac. So that was good, but we're gonna keep. So, and you know what else too? When you hear heart failure, it just seems like those two words should not go together. But we are living in different times where medical technology has grown within the last 5, 10, or 20 or 30 years, but someone can actually live a normal life with heart failure, correct?
Absolutely. And we actually it's interesting that you bring this up because also in our field, so many patients give us the feedback. Why is this called heart failure? It just has such a negative connotation, right? But heart failure, actually, if caught early, can be treated. And even if caught late, we now have advanced options to help people live longer. So even though I think the term failure we're still toying with that. It's a serious condition. It's a chronic condition, but there are treatments available.
Okay. Now, and I'm just speaking about my dad because this is like the best example.
Yeah.
He, on June 20th, he had to wear a life vest. So he wore a life vest for 3 months. It seemed, and he was in and out of the hospital for about 4 times from June 20th to current. And as you know, some of the side effects to the medicines can affect you. You have to get that fluid off.
Yes.
But what I was going to say is it seems like it was a difference from when he was wearing that life vest. He had more strength, more energy than when he was in the hospital the second time. And that's when they diagnosed him with that TTR. It seems like just the shortest walks exhaust him. He's very exhausted now. It just seemed like it was such a decline in the strength and the energy from just that short period of time. But I guess that goes back to what you said, when you wait so long, that can actually be the turning point.
Yes, especially with TTR amyloid. We're learning more and more about this disease. It actually is very common in African American patients. There is a genetic predisposition also to it. 1 in 4 African Americans carry a genetic mutation that can predispose for cardiac amyloidosis. That doesn't mean everybody develops it, but I just mention it because it actually is very common. And if you catch it, I mean, I'm sorry to hear about your dad because it does sound like his form is advanced just based on what you're describing.
Yes.
If cardiac amyloid is caught early, we can start disease modifying treatments earlier on in the course and prevent somebody from getting to the point where they start to get more and more of that fluid buildup, more and more of the fatigue and the loss of energy.
So you being a cardiologist, and when someone is diagnosed with heart failure, I can imagine that it will be, and I don't want to say trial and error, but it will be a point where you have to figure out what medicine works. Because again, fluid buildup is common in patients who have heart failure, correct? Speak about the fluid buildup.
Yes. So essentially, heart failure, there are different types of things that can cause heart failure, but the heart is failing to move the blood forward. And so the blood and fluid therefore backs up. It backs up into the lungs and it causes shortness of breath. It backs up into our tissues. So you can get swelling in your abdomen. You can get decreased appetite from that. You just feel full all the time. And it can back up further and into the legs. And so the reason that we're seeing the fluid buildup is because the heart's not pumping the blood forward anymore as well as it used to.
Okay. And we see that my dad's appetite has never decreased. I'm just saying he's eating very, very well.
Good.
So, but he did have an issue at one point with the medicine that needed to flush out that fluid. Okay, so we're going to call that, and my mom and I call that the pee-pee pill. That's what we call it. It's just too many pills. So he's on about 5 or 6 medicines right now. So we call it the pee-pee pill.
Yes.
And but that PP pill wasn't really working. So
Uh-huh.
then they did a booster.
Uh-huh.
But I remember, and I listened, and I remember them saying that with that booster, it could be hard on the kidneys.
Mm-hmm.
So how do you balance all of that? And my dad did have to go in. They take his blood work all the time, which is great because they
Mm-hmm. Yeah.
monitor. But it did have to go in because his creatinine
Yes.
level
Creatinine. Mm-hmm.
more than doubled. So, but now he's not on that booster. He's
Mm-hmm.
on the regular PP pill, but the
Right.
fluid in his legs is unbelievable. Like in the morning, I'm talking to my mom, and she's like, "Oh my goodness!" Like it's like seeping through. Like one
Yeah.
day I was over there, the whole bottom part of my dad's pants were
Mm.
drenched.
Yeah. It's a very delicate balance. So the kidneys are very sensitive. If they don't have enough blood flow forward and you have too much fluid on board, they're not happy and you can see the creatinine rising. But if we overdo it with the fluid pills or the PP pills, as you call them, and the booster, we can go the other way and we can actually take out too much fluid and
Right.
affect the kidneys.
Okay.
Part of the other thing with the swelling in the legs, not all of it is related to intravascular fluid buildup, which is what we treat with the PP pills or the fluid to make you we call them diuretics. So
Yeah.
some of the fluid that's in the legs are because of the amyloid and the vessels in the legs over time with having this issue with fluid backup become very, it's not another not nice word in medicine, but as we say, venous incompetency, or the
Right.
veins can't return the fluid back. And so we run into this issue where if you try to get rid of all the fluid in the legs, you end up hurting the kidneys.
Okay.
So you have to balance that.
And again, some things can just be age.
Some things can be age related.
Okay. All right. Now, as far as, and I don't know if you can touch on this, the medicines were so expensive
Yes.
for my dad, and we just had that conversation and one time when he was in the hospital, and we were saying, do you know how many people probably pass away because they can't even afford to purchase the medication that they need to be on for their heart? Like
Right.
the pill that my dad is on for his
Mhm.
TTR, that's $600 a day.
Yeah. Tafamidis.
600, and
Mhm.
it was like, okay, you'll get a 90-day supply. Now I
Mhm.
failed every subject of math all through high school. All I know is that's high. But
Yes.
we were grateful because the hospital worked
Mhm.
with him to
Yes.
where he did not have that copay. But even the life
Mhm.
vest for him to wear it for 3 months, his out of pocket expense was $1,800.
Very expensive.
So it's horrible when I think about the people who live in poverty
Mhm.
and have to take these medications. We're talking about your heart.
Mhm.
Have to take these medications for your heart. How many people have to crack a pill in half because they have to make this last? Do you run into things like that?
Yes, unfortunately, all too often. And you're right. I mean, healthcare disparities are everywhere, and especially for TTR cardiac amyloidosis, the tafamidis you're talking about is extremely expensive.
Mm.
And so we run into it all the time. What we do at our center, and if you are or anyone's diagnosed with TTR, it's good to be seen by a center if you can, who specializes in infiltrative or cardiac amyloid, because we basically have a specialty pharmacy that works with the patients and works with their insurance to see what we can do to help with the copays. But
Okay.
sometimes we do run into the case where the patient simply cannot afford the medication. It's horrible. So we look for clinical trials because thankfully this is an area of active research. There's several other drugs that are in the pipeline that are very promising. So we try to get patients enrolled in trials if we can. And then there is a generic medication called diflunisal. It's not as good as a tafamidis, and you have to do monitoring of blood work more often with it because it can affect the kidney and the liver more. But sometimes when you're left with, when you have so few options, you kind of have to do what you have to do to help the patients.
That's true. Are there many types of heart failure? And are they all called like heart failure? You know what I mean? Like we know TTR is a form of heart failure.
Right.
Is there many types of heart failure?
Yes, there are actually several types of heart failure, and they're broken down in different ways depending on which society you look at. But essentially, there is the type of heart failure where the muscle of the heart no longer, so the heart is supposed to do this with every heartbeat. With some types of heart failure, we call it heart failure with reduced ejection fraction. The heart is kind of doing this. So it's really not able to move blood forward. Then you have heart failure where the heart's able to pump, but it's so stiff that it can't relax in time to fill back up with blood. So those are the categories. Now, there are so many different types of diseases that can lead down the pathway of heart failure. Cardiac amyloidosis is just one cause that can lead down this pathway. And for cardiac amyloidosis, it often starts with the second type where the walls are they're thick and they can't really relax. And over time, it can progress to the type where it's also not pumping well forward. Some of the more common types are actually blockages of the heart. If you have several blockages of the heart, that can lead to heart failure over time. It can also be genetic. It can run in the family. It can be related to toxins. If you've had chemotherapy in the past, certain medications for cancer treatments can be cardiotoxic as well. Excessive use of alcohol. So there's a huge litany of causes for heart failure.
Now, what about cholesterol? High cholesterol?
So high cholesterol all leads to the pathway of the blockages in the heart. Something that we call metabolic syndrome goes with high cholesterol, similar family as diabetes, being overweight. All of these things together increase your risk for having blockages in the heart. So in that way, that can lead to heart failure. And even without blockages in the heart, if you have kind of the trifecta, or you have diabetes, you have high cholesterol, and you're overweight, that causes inflammation, we think, in the body that can ultimately lead to damaging the heart muscle as well.
Dr. Vora, for someone like me, and I make all of my yearly visits, I get my blood work. This with my dad I'm telling you, it scared me.
Yeah.
And for someone, or for our viewers, how do you, because your normal physical won't reveal if something is actually wrong with your heart, correct? What's the proper way, or what should one say to their doctor to make sure, listen, I want to make sure or rule out that there's something wrong with my heart. I want to make sure that my heart is healthy. What would you recommend the viewers to say to their primary physicians?
I think the main symptoms just to look out for and to make sure you mention to your primary care physician would be shortness of breath, chest pains. And even if you don't feel short of breath, oftentimes patients will say, I used to, run up 2 flights of stairs, and now I kind of have to walk up them. So a slow decrease in exercise tolerance is also concerning, even if you're not actively short of breath. Any swelling in the legs is really important to bring up. The other signs sometimes to think about is if you're having trouble sleeping at night, If you can't lay down flat at night, so if you suddenly need several pillows to get comfortable, that can indicate a heart problem because that fluid that builds up when you're laying down, it affects your lungs more.
Mm.
So those are some of the things to look into, or just to mention to your primary care. Also, beyond a certain age, everyone should be getting an EKG at least when they go see their primary care doctor. If you have high blood pressure, you should always get an EKG. So I think it's just really important that if you feel like something's not right, just bring it up
Okay.
to
I
hopefully
have
prompt more testing.
Okay, I have a very strange question. So I don't always eat the way that I should. So when I
Mhm.
go to Wings to Go and I have my buffalo wings with my ranch
Yeah.
and my blue cheese, and then I'm like, oh, I'm gassy. Why does it feel? And I don't know if you know the answer to this question. Why does it feel? And I can feel like the gas coming up, but it
Yeah.
feels like it affects your heartbeat sometimes. Is that because the esophagus is so close to the heart? Is it just gassy all up in there? Explain that piece. And because you know what acid reflux, I'm like, okay, baby, listen,
Yeah.
I got $5 under my pillow. I got two sons. Give 250 to one son, give 250 to the other, because I know I'm not gonna make it out of this one alive. So tell me about gas and how that affects the heart.
Yes. So you really did hit it close. The heart sits on top of the esophagus. And when you have really bad acid reflux, that causes this burning sensation that affects basically all the nerves in the chest. And so that's why it feels like it's affecting your heartbeat. And sometimes it may actually be causing some ectopic heartbeats, which are not abnormal. Everyone has them. They're abnormal if you have a lot of them all the time.
Okay. Okay.
But
So
if
it's
it's, yeah,
okay, like if you're like, oh, what was that's it. That's just it. But it's okay for the heart, I guess, to skip a beat every now and then,
yeah,
or for you to feel a flutter or something like that.
right.
You know what amazed me, Dr. Vora, and I'm sure you heard about it and watched it. My husband's just a football fan, basketball fan, but
Yeah,
I was watching the game with him
yeah.
when that young man
Hmm.
he just fell out. They worked on him for 10
Hmm.
minutes.
Yeah,
So again, my dad, he's a pastor. My
yeah.
dad has been in the church and he's a strong believer. My dad's
Hmm.
a reverend. And he said, if anybody did not believe in God
Hmm.
after that point, because how do you be dead for 10 minutes
Right,
and then be able to function? Because in cardiac arrest, that oxygen going to your brain is crucial.
right.
So is that something that just was like beyond reality, or have you seen anything like that before?
No, we have seen it. And if there's any silver lining to what happened in that case, is that hopefully it's bringing more attention to the importance of bystander CPR. The
Okay.
reason, even though his heart was not working, the people who he got immediate attention and they started doing the chest compressions. When they did that, there was some blood flow going to the brain. So
Okay.
the key is that's why we all should learn CPR, at least the basics, because if somebody goes down, if you're able to circulate their blood, even a little bit of blood to the brain, that can cause someone to have a full neurologic recovery.
Wow. Oh, so you know what? That CPR is
Yes.
actually, oh, that's amazing. I never
Right.
even thought about it. You know what I
Right.
mean? Like that. So that's actually circulating to give
Yes.
this person even more of a chance.
Right. Because the brain is very, very sensitive. So if it's truly deprived of oxygen and blood for a long period of time, even a full minute, you can get permanent damage. So the main purpose of CPR is to circulate blood, even if it's not getting as much oxygen as blood would if someone's heart's working. That's, I think, what led to him having a good recovery. And we
Wow.
see it. I've seen patients do well as long as that we say bystander CPR. If it starts right away, there's a chance.
Okay. Okay. Well, I want to thank you so much. You broke everything down to where everyone could understand it. So heart failure does not mean a death sentence. It does not mean
Right.
it is the end of the road for anyone. And I know those doctors were tired of me because every time they came in, I was like, is it treatable? Is it treatable? Is it
Right.
treatable? Is it treatable? So they would say it's treatable, but not fixable, if that makes sense.
Exactly. It's a chronic condition, just like diabetes is a chronic condition. It's something you have to manage.
Okay. And you can manage it and still live a long life
Yep,
and be around with your family members for years to come.
exactly. You just got to get attention.
Yes, that's true. That's true.
Yep.
Well, Dr. Vora, I thank you so much for joining me today, and everything that you spoke about was very educational. So that means that all of the viewers, including myself, we have to let our primary physician know that we need that EKG, and whatever the outcome is, it's treatable. Thank you for joining me today.
Yes, thank you so much. It's been a pleasure.
Thank you so much for joining me today. We had a very enlightening conversation about heart health. Know that it is not a death sentence if you hear that you have heart failure. The medical technology has come so far. Please adhere to all of your doctor's advice. Make sure you take the medicine that is prescribed to you. And I wish you all the best. Peace and love.